I do believe that certain patients should be screened using CRPs, homocysteines, and EBCT. I think that these techniques are probably being used injudiciously. EBCT, for example, does not necessarily tell you that a patient has an obstructive lesion that is likely to cause ischemia or angina. Patients have to be convinced that what EBCT is a risk factor score. It's a risk factor no different from their cholesterol, no different from their blood sugar, no different from their blood pressure, no different from smoking. But it requires going to a center and having a procedure done that tells the likelihood of having an event. Who should get EBCT? Well, I think the asymptomatic person with high risk factors is clearly a candidate. And I also think that somebody who has low risk factors but lives in a stress environment should also be screened. But let me be clear, these are not diagnostic tests for coronary disease in terms of obstructive disease. These are tests that predict probabilities of events. Not yes or no, but relative probabilities. My honest opinion at this point is patients should not be screened with these techniques, at least for their coronaries, because the results are just not good enough. The pictures are not good enough consistently. And I think you can do as much harm as you do good.